Layoffs are now underway for 10,000 workers at the Department of Health and Human Services. One worker who says he was laid off back in February confronted Republican Senator Jim Banks from Indiana about his firing. Take a look at how the senator responded.
Hi, I was a worker at HHS. I was fired illegally on February 14th. There are many people who are not getting social service programs, especially people with disabilities. Are you going to do anything to stop what's happening?
You probably deserved it.
I deserved it?
You probably deserved it.
I deserved it.
Dude, that's
wow.
sad.
Yeah, that's great to hear. Why did I deserve it?
Because you seem like a clown.
After that video was posted online, Senator Banks reposted it with the caption, "Hard Truth." He also changed his profile picture, you see it there, to a screen grab of his face as that elevator door was closing. Let's bring in NBC News health and medical reporter Berkeley Lovelace. Berkeley, we're just beginning to learn about the effects of these cuts, what the effects could be. I spoke to Dr. Derek Haas earlier today. She used to be a regional director with HHS under Biden. She resigned before President Trump took office, but she knows a lot of the people affected. She's worried in particular about cuts to the Substance Use and Mental Health Service Administration, or SAMHSA, which runs programs to support people in recovery, people with mental health issues. Take a listen.
These programs are losing funding. Last week, they announced $1 billion in loss of funding. And yesterday, they fired a bunch of people who work for SAMHSA to connect with the community programs. So how are patients supposed to get care if the program they depended on no longer has funding, and the person they depended on to help find out what is going on with the funding no longer has a job?
So the agency that Dr. Cass was talking about there is being folded into a new agency by the administration. What do we think might happen when that change happens?
Yeah, that's a great question, and it's really unclear right now, as the administration is not giving very many details on how this will all work. We do know some divisions will be folded into this new agency called the Administration for Healthy America, but many of the folks who worked in these groups have now been let go. So the question is, who is going to do this work now? So another example of this is the Division on HIV Prevention. Some of that work, I'm told, will be folded into this new group. But many of the federal workers who did that work were fired yesterday. A lot of the senior leadership, people who have worked there for years, for decades, have decades of experience on these subjects, were also let go. So we'll be watching over the next few weeks about how this all shakes out for the administration. Kate, Secretary RFK Jr. is expected to testify next week before a Senate committee on these job cuts. So we should have more details then as well.
Berkeley, a big role also for HHS is to communicate information about outbreaks, about other health emergencies. Do we know what these cuts might mean for that function?
Yeah, to add to that, around 80 people in the government who help us prepare for health emergencies like pandemics were also let go this week. I think it means that we're going to be even more dependent on states and local groups to do a lot of this work. As you know, the administration is also pulling back funding from state health departments, including work on infectious diseases. So states are already pretty limited right now. I also think we're going to be hearing less from traditional government agencies like the CDC and the FDA going forward. Many of the communication departments in those agencies were also eliminated. A lot of those functions now going forward are going to be put directly under Kennedy at HHS. So once again, we really don't know a whole lot of how this will look or function, Kate, but we should know in a few weeks.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.